When we decided to do this episode, I was thinking like when was the first time that I actually realized probiotics or a bacteria could make something. Then I realized it just went back to, my childhood a little bit. But
Mhm.
I think it was a couple of years ago, Rachel. Do you remember? I actually made a yogurt and gave it to you, and you were like, "What? Like, how'd you do it?"
It's funny because it's like you say that and it like now brings up this memory that was like repressed or something. Like, and I'm like, "Oh yeah, I actually do remember you bringing that over."
Yeah, that day we went to, a garden. I don't remember the name of the garden in Minnesota, and then
Yeah.
after that, I was like, "I brought you yogurt," and you were like, "You know how to make yogurt?" And, you know, so then as the time went on, I was, like, kinda thinking the way I make yogurt was pretty much, it was when I was little, that's how my mom made it. She would just boil some milk and then, use, like, a little bit of yogurt from before and then mix
Mhm.
that with milk, and then we would have, like, a batch of yogurt, and I'd be like, "This is magical. How does this happen?" Because 'Cause she'd just, like, wrap them with the blankets and everything. What I didn't know back then, my mom was adding some bacteria culture to the milk and then giving the appropriate environment for bacteria to grow and then form this new food yogurt, I guess.
Mhm.
But after a while, I realized that actually I was just making myself more, open to like exposing myself to food poisoning. So make sure that you're using thermometers. Turkish method is not the safest. So
It's kinda funny, like, you bring that up too, because it's like, I think so often we're so disconnected from food that we buy in the store and forget that, like, we can actually make a lot of this at
Mhm.
home. But, yeah, yogurt is one of those things that's, like, we forget has bacteria, like, living bacteria in it, and that's good for you, like, it's not bad. And I think that's a great segue into today's topic because there are good and bad microbes that live in our bodies, and they can have some pretty big impacts on our health. So, today we are going to be talking about the microbiome and specifically how it relates to mental health. And I love the title that Ilkai came up with for these series today. So, do you want to introduce that?
Yes, our title is called in the honor of February, the month of love, for the love of gut, part one.
Yeah. So, for those of you who are new here, welcome back to our podcast, Bite of Mind. We are both registered dietitians. I'm Rachel,
And I'm Ilkai.
and we love talking about everything related to nutrition and mental health. So, today we are going to be deep diving into our gut biome and how it relates to depression. So, before we do that, though, I do want to give a quick disclaimer that this podcast is for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Listening or watching does not create a provider patient relationship. Always seek the guidance of your physician or other qualified health professional with any questions you may have regarding your specific health or nutrition needs. So I love that you bring up the idea of bacteria because
Mhm.
bacteria is something that is super fascinating for me. um,
I agree.
But yeah, it is. And, we have good and bad bacteria in our bodies and living in and on our bodies, on our skin, in our digestive system, all this stuff.
Like, one of the first things that I kinda, like, realized again when I was in school, back then that and actually it was in our microbiology class. This was back so our professor mentioned the fact that, we're surrounded, like, he says, "Well, you have bacteria in your mouth right now, you have bacteria on your skin and in your body." I'm like, "We do?" Like, I remember thinking like, "Really?" I thought maybe in the gut for sure, but on my skin and in my mouth for sure. So, yeah, I mean, his argument was a little bit weird. He would just say, "Don't brush your teeth so that you don't, like, ruin the bacteria population in your mouth." But, yeah, we are surrounded by bacteria. Everything, our body, everywhere we touch, and we can't see them, and I think that's the fascinating part for us, like, we live
Mhm.
so close with them, but we
Yeah.
can't see them.
And what's fascinating to me is like when we were in school learning about GI conditions, one of the
Mhm.
things that had brought up was like H. pylori infection. So ulcers in the stomach being caused
Yeah.
by, now we know, bacteria, H. pylori. But way back in the day, you would get a stomach ulcer. People didn't know that they were caused by bacteria. That's actually like
Mhm.
very or fairly new, as in, just the last several decades that we've realized that bacteria in our digestive system can cause inflammation and pain and disease. So it's really kind of interesting, kind of tying this back into mental health though a little bit. I remember in school, we talked about
Mhm.
in our medical nutrition therapy class, our segment on GI conditions. I remember
Mhm.
discussing how conditions like IBD, so that's like Crohn's and ulcerative colitis for our listeners there, that's
Mhm.
inflammatory bowel disease, IBD. They're often strongly linked to mental health conditions like anxiety and depression.
Yeah.
And so, again, for our listeners, IBD involves chronic inflammation of the digestive system, Crohn's being anywhere in the intestine, small or large, and ulcerative colitis being just in the large intestine or the colon.
Mhm.
And I remember talking about how IBD can often fuel anxiety as well as vice versa. So, like, where unmanaged anxiety can worsen symptoms of IBD. And at the time, it made sense to think that stress caused by anxiety could contribute to inflammation in the bowels. But what
Yeah.
we now know is that the microbiome is actually a huge contributor to this relationship and the inflammation.
Yeah, when we look at IBD and IBS, one of the things that we see is just one kind of bacteria's overgrowth. So it's almost like, good and evil's battle, and then evil wins, and then you end up with these symptoms. Like that's kind of what I think in my head. And that's why it's like fascinating to me to see how mental health can affect that too. Because at the end of the day, it's like kind of
Mhm.
connected to each other. Because when
Mhm.
you're feeling anxious, then with IBS symptoms, it definitely affects your like bowels conditions where you're
Mhm.
either having constipation or you're having diarrhea. And in the end, these symptoms affect the bacterias down there and vice versa.
Mhm.
Bacterias over there and their population, the number of bacterias, the different strings also affect your mental health in a way when when things are working correctly, I guess.
Mhm. Yeah. Well, and that's what's been so fascinating to see. I remember when we had kind of started graduate school, 2019, 2020, that the
Mhm.
research on microbiome and it's specifically related to like mental health was so new. Like there wasn't a ton of research. I mean, there was research, but it was very new, preclinical stuff, and just really starting to tap into how this basically tap into the unknown of like this
Yeah.
unexplored area that we knew there was bacteria here, but we didn't quite know how it was related to all these things. And it's been really fun to watch it evolve just over the last 5, 6 years. And
Yeah.
seeing now that there is a growing body of research that's revealing that
Mhm.
connection between like that gut brain axis.
I remember gut brain axis being like a fairly new term, and everybody's like, "Did you know that?" In the school, "Did you know that gut and brain are actually like kind of connected to each other, kind of a stuff." But
Hmm.
I feel like I remember this from Turkey because I was like, "Oh, really?" And then I was selling this information to my like family members. Like your gut
Yeah.
is even connected to your brain, so nutrition is important. Like, it was absolutely just a new thing, relatively new thing. Now it's growing more and more, and then we see in the
Hmm.
market there are lots of different probiotics, and then prebiotics or fiber are becoming like a
Hmm.
big hit too. I guess since both of us are interested in that's why we were like, yeah, let's just touch base with this topic for sure.
Yeah. Oh, definitely. Yeah, the gut brain axis like has been shown now to be related to so many different illnesses, right? Like anxiety, depression,
Mhm.
bipolar, schizophrenia, OCD, even substance use. We kind of talked a little very briefly, I guess, on microbiome in our episode on alcohol use and depression, but just even how the microbiome could play a role in substance use disorder treatment and symptoms, especially when you look at like depression being comorbid with that. It's just really, really fascinating. But I think we need to step back for our listeners for a sec that in order to kind of answer our questions of like how is the microbiome related to these things and mental health conditions, let's take a step
Yeah.
back and look at what is the microbiome.
Microbiome is actually, our entire body at the end of the day. Microbiome is the healthy, good bacteria that are living with us. Like they are
Hmm.
symbiotic organisms that live in our body and help us with various benefits, various health benefits,
Hmm.
from improving our immune system to again keeping our body in balance and then working properly with our digestive tract, whether it's our digestive tract, whether it's our like mouth health, whether it's our skin health,
Hmm.
with everything, our microbiome is what protects us.
What's cool too is like looking in the human gut, like we don't just have like 5 microbes that live in there. Like we have between 1,000 to 5,000
Wow.
different diverse species of bacteria that live in the digestive system itself. That's not to mention, like you're talking about too, on our skin and our mouth. Like there is thousands of these types of microbes that live
Yeah.
inside and on us.
These can be fairly stable from when you were born because, like, at the end of the day, it's like, you meet your bacteria as soon as you're born and then it becomes your thing. It's just this romantic relationship. Let's touch base with love, right? Like, this is the month of
Yeah.
love. But over time, dietary changes can affect this. Infectious pathogens like C. diff, for example, is one of the
Hmm.
biggest examples that we see in the hospital on a day to day basis, or sometimes food
Hmm.
illnesses or foodborne illnesses because they might
Hmm.
contain certain string of bacteria in them. Antibiotic use is one of the very common ones because whenever I ask people about probiotics, they're like, "Oh yeah, I use probiotics after I use antibiotics too," which makes me really happy that doctors are actually
Hmm.
recognizing that how
Yes.
the gut microbiome is now kind of disrupted, and then let's just do something and then provide
Yeah.
these people with some like probiotics.
Well, yeah, because antibiotics, I think with antibiotics, it's important to mention too, like
Mhm.
antibiotic literally means antibacteria. So it's killing not only the bad bacteria in our body that's causing the infections, that's forcing us to take the antibiotic in the first place,
Mhm.
but it can also disrupt a lot of these healthy and good bacteria that's in our
Yeah,
digestive system, which is why it's so common to get like diarrhea when you're taking antibiotics because you're disrupting
absolutely.
the microbiome.
Absolutely. So, that's why, like, it doesn't differ from, "Oh, this is a bad one, let me kill the bad one." No, it just clears out all the bacteria so that you can actually be like, "Oh, thank God, I'm just relieved
Mhm.
from whatever infection that was." And
Mhm.
besides that, of course, stress affects it too, because when we are stressed, we start producing different hormones, different chemicals in our body, and that's also creating some sort of imbalances for those
Mhm.
bacterias because, they're
Mhm.
residents. Imagine like, you're
Yeah.
bothering your neighbor constantly with your stress and then screaming at home. And those bacteria are like, okay, I'm out of here. This is not a
Mhm.
livable condition for me.
Well, and like we'll kind of see through this episode too with like stress is that it's a two-way street. It's like our
Hmm.
microbiome can also impact our stress responses and our
Yes.
inflammation and stuff, which we'll talk about here in a little bit.
Yeah.
But it impacts it both ways.
Absolutely. It's not like, we're that's what I like about it. It is a very democratic environment. It's not that we can just, run the show all by ourselves. They're on the show sometimes, you know.
Hmm. Yeah.
It's a two-way street between us and the bacteria who are living in our body. And some medication exposure and environmental toxins, of course, as well as it affects us, it affects other organisms that are living in our body too.
Hmm.
So yeah, I mean, those are some of the factors. Is there anything else you'd like to add, like you can think of?
Yeah, I think like one fascinating thing with the microbiome that I want to kind of mention to people, because you did say that like our microbiome is fairly consistent and stable, like once it's established. And a lot of these things can impact and change our microbiome, but in general, it tends to be fairly stable. And I remember in our microbiology class when we were kind of talking about microbiome, I found it really interesting to learn that like babies, when they're first born, are kind of
Yeah.
considered like sterile in a sense, like they have no
Yeah, they
microbiome.
are.
And so, depending on how you were born, the microbiome of the babies are going to be slightly different. And I do want to mention
Mhm.
that this is not to say that like one way of being born versus the other is better or the other,
No.
because a lot of these differences do disappear around 1 to 2 years old. But at the early stages of life, there are differences. So it was interesting. I remember our microbiology teacher talking about too that babies who are born via C-section, their microbiome tends to reflect similarly to their mother's skin microbiome, while babies
Mhm.
who are born vaginally tend to have the GI system bacteria that reflects their mother's vaginal bacteria.
Mhm.
And it was very interesting to see that, like, that kind of sets up the basis of the first initial bacteria that's in that baby's gut. And of
Yeah.
course, this will change over time and grow based on then their diet, what they eat, and other
Mhm.
things they're exposed to, stress, age, genes, all that stuff. But at that very first, how you're born really actually does kind of establish it.
Yeah, the very
Mhm.
first contact, so the skin also makes sense to me. I mean, we both are
Mhm.
mothers, but I know that, skin to skin, doing skin to skin with babies can improve your, like, chances of being able to breastfeed your children. That's one
Mhm.
of the things that we do. We recommend to mothers, in WIC setting, or like when we're
Mhm.
working with, mothers of toddlers or infants. So yeah, I mean, it's like pretty much whatever the first contact point is, that dominates for a while what your microbiome looks like, pretty much. That's kind
Yeah.
of what we're understanding from it. And yeah, I agree. It's absolutely fascinating because, you get lactobacillus, I think, during the
Mhm.
vaginal birth. You start drinking milk too, so you're able to kind of like break them down
Digest it.
easily, and
Yeah.
obviously, yeah, digest it a little bit better too. So it just kinda is like, okay, it makes me realize this one factor that everything is like works with a harmony.
And it's kind of cool to see too that the microbiome in our gut isn't just responsible for our GI health or the
Mhm,
digestion absorption of things, but it also plays like a big role now in mediating that gut brain communication. And it does
mhm,
this specifically through its metabolites. So that's like the tiny byproducts that like
mhm.
the bacteria kind of put off through metabolism. And that can affect neurotransmitter production, hormones, and immune function.
Alright, let's just, like, get back a little bit because 'cause you've done so much research about this, and I want you to enlighten me and then our, like, listeners too, or viewers.
Yeah.
So, how does this microbiome, like, specifically microbiomes, what's the pathway? How does it affect, depression at a biological level? What happens? What kind of, like, hormones or, metabolites are being secreted that we are, like, connecting those things together.
Great question. I do want to point out here too with depression that this is a big topic of conversation, and we're studying a lot of this because depression is ranked as one of the top three causes of burden and disease worldwide. And the
Mhm,
WHO actually projects that depression is going to rank number one by 2030. So that's only like 4 years away now. And the reason that depression is so kind of challenging to manage is because it has so many different various presentations in people. It can be really
yeah.
unpredictable in its course and prognosis and can even be variable in or have variable responses to treatment. Like we see that the current like medications that are commonly used in depression may work great for some people, but for others they don't work at all.
Yeah.
And so it's kind of been this question of why is that the case? And so this pathophysiology of depression is a very intricate process. And it's kind of been fascinating to see the microbiome now be discussed because we're now
Mhm,
starting to see that chronic low grade inflammation in the brain, so that's called neuroinflammation,
mhm.
contributes to mood changes, cognitive disturbances, and symptoms of like depression. So things like fatigue and lack of motivation. So those inflammatory signals that are
Mhm.
causing this neuroinflammation can alter neurotransmitter systems, they can impair our neuroplasticity, they can even promote neuron damage, all of which are
Yeah.
observed in things like depression.
For our viewers and listeners, neuroplasticity refers to the brain's ability to reorganize and rewire its neural connections, enabling it to adapt and function in ways that differ from its prior state. Pretty much meaning that when you're learning new skills, experiencing environmental changes, and recovering from injuries or like those sort of things, it's just adapts the new situation, which is like it's pretty much our survival response, right? Like our
Mhm.
brain's
Yeah.
survival response in a way that we can mutate and then focus, rewire ourselves to the new situation so we can actually
Mhm.
fit. ourselves in.
Yeah. And so when inflammation is impairing our neuroplasticity, it's going to lead to more of the types of symptoms that we see in a lot of the psychiatric conditions. So, and it's also really interesting. I want to mention too that neuroplasticity has been looked at now in neurodegenerative context as well. But going back to the context, this neuroinflammation or the inflammatory signals, I should say, that are kind of present in the brain have
Mhm.
been shown to be impacted by our microbiome. So, gut dysbiosis, so that's like the imbalance of the microbial communities that live in our gut. Um, that can
Mhm.
contribute to systemic and central inflammation in our body, so leading to that neural inflammation. And the way that it
Mhm.
does this, so like how are these connected? The way that it does this is by changing the microbial metabolites. So those are those like tiny little things that I was mentioning earlier,
Mhm.
mainly these short chain fatty acids. So you may see that abbreviated as like SCFA, but short chain fatty acids is what that stands for. And that's now known to be involved in neural, hormonal, and immune pathways, largely impacted by our microbiome.
So let's just step back for a second and explain what the short chain fatty acids are.
So, short chain fatty acids are the primary metabolites. I know I mentioned that word before, but just
Mhm.
byproducts of the fermentation process within our gut. So, there are certain bacteria in our digestive system that ferment carbohydrates, mainly those fiber-rich carbohydrates, and
Mhm.
they, as a byproduct, produce these small molecules. There's three kind of main specific ones: acetate, propionate, and butyrate. And
Mhm.
for some of our listeners, they may have heard of sodium butyrate. I've seen that kind of in the kind of wellness space talked about and tossed around because it is like a supplement that you can buy. But so for anyone who's kind of seen that, that is a short chain fatty acid. We'll talk about a
Mhm.
little bit later, like some of the research around like butyrate specifically
So,
in general.
yeah, when we feed the fiber-rich carbohydrates to those bacterias, they release short-chain fatty acids. It's almost like,
Mhm.
how alcohol is produced from fermenting fruits or beer,
Mhm. And what's kind of interesting about these short chain fatty acids is that once they're produced, they don't actually just stay in the digestive
Mhm.
tract. They are absorbed by our colon cells, and
Okay.
most of them then travel to our liver where they're metabolized. So they're just kind of turned into energy for use in our bodies. But some of that short chain fatty acids that are absorbed actually remain within our blood circulation. And some of these
Mhm.
can even cross the blood brain barrier and directly influence immune cells in the brain. So, the short chain fatty acids, once they enter the brain, can inhibit pathways that
Mhm.
regulate what are called pro inflammatory cytokines. And they also can activate protective signaling pathways within the brain. So, what that means is that the short chain fatty acids can essentially help lead to less neuron death, less oxidative stress, and less neuroinflammation within the brain.
That makes so much sense though. Like this, how come some certain fatty acids can really help, like short chain fatty acids, but at the same time, we correlate inflammation with fat directly. That's why it's just like so mind boggling to me to think about like
Yeah.
there are some fat actually can help you with reversing the inflammation.
Which is so fascinating too, because yeah, like when I was doing a lot of the research, what was interesting and coming up too was a lot of the omega-3 research, right? We know
Mhm.
omega-3 supplementation helps with neurotransmitter synthesis, helps with inflammation, especially with like
Yeah.
the reactive oxygen species. And so it's really interesting to see that like short chain fatty acids and the ones produced by this bacteria also have these anti-inflammatory, like protective effects. And that's what's so fascinating to me because fat is not just fat, right? Like there's so many, like fat's a chain of molecules, right? So you have like your
Yes, it
medium
is.
chain, long chain,
Mhm.
short chain, and how they all are metabolized and utilized in the body differently.
Medium chain, I think it's not even digested, like, it just absorbs very quickly, and,
Mhm.
we use it in situations, for example, where people have some pancreas problems where they can metabolize, like, the fat, we're like, "Okay, yeah, maybe MCT oil could be a good idea for you so you can continue to get some fat in your body because you need it. You need fat
Mhm.
too."
Yeah, like the genetic disorders that prevent you from metabolizing even certain types of chains of fat
Mhm.
was fascinating to me learning that in
Yeah.
school, where it's like everyone's body, if it's working properly, can metabolize all these different types of fat. But then you could have genetic conditions where suddenly now you can't metabolize long
Mhm.
chain fatty acids. So like you said, yeah, you have to supplement with the medium chain, the MCT. One of the things
Yeah.
that is kind of interesting with the short chain fatty acids as well is that not only are they absorbed and utilized in the body for things like we were just talking about, but they also help strengthen our gut and the blood brain
Blood-brain
barriers.
barrier, yeah.
So, yeah, so like the gut barrier and the blood brain barrier. And this
Mhm.
basically prevents, or like I should say, why is that even important? The reason that it's important that our gut and blood brain barriers are strengthened is because it helps prevent inflammatory bacterial products like
Mhm.
LPS, so that's lipopolysaccharides, from entering circulation. The reason that's important is because LPS, they trigger immune system responses and general inflammation in the body. So the
Yeah.
stronger our gut and blood brain barriers can be, the less that these LPS can enter our circulation and cause more inflammation.
Again, mind-boggling to me. You have polysaccharides in there. That's causing the inflammation too.
It's so fascinating, like, learn once you kind of go through nutrition school, right? We learn about all these different types of,
Mhm.
polysaccharides, lipids, the different kind of ways that they can assemble themselves into pieces of energy that are then disassembled in our body and utilized in
Yeah.
these different ways. It's just fascinating, honestly. Like, the biology behind all of this is so complex. Like, I am just touching on the surface of these
I
things,
know.
and a biologist is probably, if they listen to this, like, oh, they didn't even talk about these specific mechanisms. And
Yeah,
it's
I'm
like,
sure. I mean,
it,
like, but it is hard. I do the same thing with the patients sometimes, like, because I'm trying to explain them like a simple basic biology of like what's going on behind this. And I'm trying to tell them like there are millions of chemical like activities going on in your body right now. Your body is constantly, I'm talking to you, moving my hands, burning calories, like it's happening, as I'm doing it. So yeah, I mean, it's absolutely fascinating to see that we're using the word fascinating today a lot. Because we both are very
word of the
fascinated
day.
by word of the day, fascinated by microbiome and how it works. Yes.
Again, going back to the conversation, with short chain fatty acids is, with the strengthening the barriers as well, they also help prevent vagus nerve stimulation by
Mhm.
cytokines. And the reason that's important is that the vagus nerve, when it's stimulated by cytokines, can trigger our HPA axis.
Which we remember them from our alcohol episode. We talked heavily about them, how they are our body's central stress response system. When this is chronically activated, you're constantly feeling anxious or like depressed.
Yeah, and that's, like, super important when we discuss, like, mental health conditions, and we'll hear the HPA axis probably mentioned tons of different times as we talk about a lot of these topics because it is very involved in mental health. If you are interested in learning a little bit more about the HPA axis, I'm not gonna, or we won't really go into that much detail here, but you can go ahead and listen to our alcohol episode. We discuss alcohol and its impacts on depression and discuss a lot about the HPA axis in that video or episode. So if you are interested in that, I would recommend checking that out. But in general, like Ilkai was mentioning, chronic HPA overactivation increases inflammatory cytokines, which in turn perpetuates the stress signaling. So exactly like she was saying, reinforces a lot of the symptoms of mental health issues.
Okay, so cytokines, we've heard about them. I feel like 5, 6 years ago during COVID time, it was just kind of I wasn't really 100% paying attention because I was overly depressed over COVID, but I've heard those words. So you
Yeah.
tell us, enlighten us, what are the cytokines?
Yeah. Yeah, so during COVID, you probably heard, like, the term cytokine storms. I don't know, maybe. But cytokines are basically just small protein messengers in our body.
Mhm.
So our cells use them to signal to other cells. So they're mainly
Yeah.
used to activate and coordinate, like, immune responses in order to fight infections. Not
Okay.
inherently a bad thing, but overproduction of them can cause chronic inflammation and disease. So
Mhm.
we saw in our previous episode when we were talking about alcohol that alcohol interacts with the HPA system or HPA axis, I should say, specifically with that CRF system. So, for our listeners who don't know or have not listened to that previous episode, the CRF system is corticotropin releasing factor. It is the hormone that is released that basically starts the whole cascade of the HPA
Mhm,
axis.
mhm.
And this is largely impacted by short chain fatty acids. So we found that they can influence the system as well. When we talked about alcohol too, we also mentioned how alcohol impacts that system as well. So
Yeah.
that CRF system can be impacted by a decent amount of things. But we know through research, or I should say through preclinical studies, that short
Mhm.
chain fatty acid supplementation, mainly they kind of used like butyrate when they looked at these things, they found that that supplementation can decrease the CRF expression as well as other stress related gene activations, but in general, just reduced the HPA axis reactivity,
Okay, so when we
which is
step
crazy.
back, what we're actually mainly seeing on a day-to-day application is pretty much eating fiber, like fermentable fiber or fermenting fiber in our gut is helping us to reduce stress related or like stress related hormones, pretty much, or stress related cytokines in our body.
Yeah. So essentially, like the short chain fatty acids that are produced from, yeah, consuming fiber when we feed
Mhm.
our gut lowers that lowers the inflammation in our body related to like HPA axis and
Mhm.
neuroinflammation and all these other areas. One of the interesting things I think when we talk about like the preclinical studies and using like the short chain fatty acids and supplementation to decrease these expressions, I think it's really easy to then jump into going, okay, so if we just supplement these things, would we fix like depression or fix these
Mhm.
things? And I just want to point out, we'll kind of talk a little bit about this in our next episode too, when we talk
Mhm.
about fiber and probiotics and things as well. But
Yeah.
utilizing a supplement like butyrate could have benefits to reducing HPA excess active reactivity. That's kind of what the preclinical studies have been showing. However, as a the dietitian in me kind of goes, that's just almost like a band-aid solution. Like it doesn't
It is.
solve the actual problem, which
Yeah.
is lower bacteria that is producing short chain fatty acids.
You
So,
are not creating that microbiome inside you
mhm.
where it can sustainably, produce things. You would only be
Mhm.
getting the benefit of just the short chain fatty acids if you just supplement yourself with that. But there are like
Exactly.
bunch of other benefits that comes from it. And frankly, I don't think short chain fatty acids by themselves just like the effect of it, but overall even feeling good when you can go to bathroom more regularly, you just feel better about yourself, like
Mhm.
because your digestive system doesn't bother you. So it's even
Mhm.
that alone is a good effect of like in the mental health.
Mhm.
That's kind of the way I see it. And that's why, you know, before supplementation, let's see what can we do with food and how can we enhance our microbiome with that.
Well, and I think it's important to mention too that when we look at chronic stress and conditions like depression, that we've have in studies shown that people with depression and chronic stress have lower abundance of the bacteria that produce short chain fatty acids.
Mhm.
So like in their digestive system, they have less firmicutes, the bifidobacterium and lactobacillus. And
Mhm.
these three help produce short chain fatty acids. However, we also know when we talked about earlier in this episode that our microbiome is largely impacted by diet as one of the ways. And we know that when we consume more fiber, the fermentation process of eating that fiber, it encourages those bacteria to then reside in our gut. There is research that we've looked at that being able to add fiber in the diet helps
Mhm.
to replace these short chain fatty acid producing bacteria, which then produce the short chain fatty acids
Yeah.
and basically help reduce HPA excess reactivity and the
Mhm.
neuroinflammation and all of the benefits of the short chain fatty acids. So, like, that's getting to the root of the problem, right? We
Mhm.
have low short chain fatty acid producing bacteria. If we're just supplementing with a short chain fatty acid, that's kind of a band aid solution. Maybe
Yes.
it's useful in the meantime while we're rebuilding the bacteria in our gut.
Yeah.
but it's not going to be a necessarily a long-term solution. And I say all of this knowing that we don't have tons and tons of research on this yet. Like, this is a very new
Mhm.
area. Maybe it will
Yeah.
turn out that supplementing with something like that is actually the better way to go. But from just my experience in the nutrition realm, my knowledge and education is that we want to kind of fix things from the root problem.
And then we just look at it
And
from a little bit more wholesome standpoint because those bacteria don't not only, produce short chain fatty acids, but they also help you with your own digestion and absorption of the
mhm,
some of the vitamins. And on top of that, yeah, vitamin K is produced by like bacterias in those good bacterias in your gut. And for those of
mhm,
you who wouldn't know what it is, it helps you with your blood clotting so that you wouldn't just
mhm.
like, bleed to death.
You did.
We will touch base with it. We will, of course, talk more about, like, what are probiotics or those healthy bacterias, what do they do in our body too, of course, like, why do we need them? But these are some of the
Mhm.
aspects, so we're not just looking at one thing.
Well, and what's even more interesting is when we look at the research, they have kind of shown that people who don't have depression, even increasing intake of fiber in their diet can lead to lower risks of even developing depressive symptoms. So
Mhm.
it's kind of interesting to look at that, like, fiber intake is important in general for our gut, for short chain fatty acid production, and it yeah, I think it just attacks things at the root of the problem.
Yeah. It kinda makes sense though, because do you
Mhm.
remember how you've mentioned that it would help, like, the reduce the I don't wanna say permeability, like,
It would be the permeability, yeah, of the
yeah.
gut.
Yeah, so, like, it's
Yeah.
pretty much reducing it from like, you're already building a strong foundation with it in your
Mhm.
brain and then in your yeah, that makes total sense.
Well, and I think a lot of this ties in really well to our next episode that we wanted to do, where we
Mhm,
wanted to dive more into fiber and probiotics and have more of a discussion on what are they, what are more of the impacts on our body and diet, and how can we get them in our diet. So I think this gives us a good foundation for jumping into our next episode for understanding, like, why is fiber important in our diet, and recognizing that uh, our microbiome is really impacted in our mental health. So if you are interested in kind of learning more about fiber and probiotics, how
mhm.
to get them in our diet, the kind of science around it, I recommend sticking around for our next episode. I also do want to mention here that though we do have early research that supports a connection between the gut and the brain, a lot of these studies we haven't like fully determined like a one to one type thing.
Mhm.
Um, that like diet 100% manages or completely eradicates a psychiatric illness. So we
Yes.
can make changes to our diet that help support our management and treatment of conditions. And that's like really important. But just know that there is really nothing that we can do in our diet that would like 100% fix psychiatric
Mhm.
conditions, just because
Absolutely.
psychiatric conditions are influenced by so many things: diet, genetics, environmental stresses, trauma, inflammation, all this stuff. Like, Ilkai always brings up all the time, like, our bodies are not a machine. Like, we're an
Mhm.
organism. We're impacted by so many things around us. So I just wanted to throw that out there at the end too. Like, um, as much as we're going to talk about diet impacting our mental health, I want everyone to know that it is not. We also advocate for getting proper management and treatment for
Absolutely.
illnesses.
We are absolutely yeah, we are absolutely recommending that too. And then yeah, I agree with you. I don't want it to be taken that way, but in the meantime, the recommendations that we're making, if it's going to help you to think, yes, I'm going to incorporate fiber in my diet to support my health, that's helpful for many other conditions, not only just for your mental health problems. There are other benefits of fiber and probiotics
Mhm,
that we will be talking about. So keep it in mind that when you're eating fiber, this is not just for the mental health aspect of it. There are other health
mhm,
benefits that you'll be getting from it too. And of course,
mhm,
it's best if you um, get a more comprehensive and inclusive care with therapies. If you need medication, medication is another thing, and diet is actually the other part of it too. keep your tummy full and keep yourself happy.
And again, just wanted to point out too, we are not making any individual recommendations for any individual people listening to this.
Mhm.
We recommend working with your own healthcare providers on things. Wanted to just provide information on how is fiber and our microbiome related to the mental health.
Mhm.
But yeah, we wanted to leave you all with a well, we have decided that we wanted to start doing a dietitian word of wisdom at the end of all of our episodes as well.
Yeah.
And Ilkai has it for today.
Yeah, sometimes it's gonna be funny, sometimes it's gonna be hopefully, more actually wise. And I think this one is really wise to open our eyes to because we've been talking about the same thing. We are a living organism. We're not a machine. I always say the same thing to all of my patients. They want to believe in the fact that what goes in, that comes out, but we're trying to constantly adapt, balance, and modify ourselves to the environment that we're living in. So that's why, with that constant desire to balance ourselves inside and out, and microorganisms in this scenario are in the front line fighting for us to bring us to balance.
Want to thank everybody for listening today to this episode. If you are interested in learning more about how nutrition and our mental health are related and connected, you can follow along for more. We appreciate any likes or follows on any of the platforms that you're listening to. You can, of course, find us every other Wednesday on YouTube, Spotify, and Apple Podcast. We always love to read comments. So if you have any comments for ideas of episodes that you want to listen to in the future, or just anything to share about the stuff that we're talking about, we love to read them. So definitely leave us a comment. We hope to see you on the next one where we talk about fiber and probiotics. And hope you take a listen to some of our previous episodes. But yeah,
Yeah.
thanks for listening.
Thanks for listening. See you all in part two.
Bye.